In this video, we'll discuss about Autonomic Nervous System, ANS. What is ANS? Central Nervous System. This one is the Central Nervous System. We have two component, brain and spinal cord. Can you see the brain and spinal cord? This is Central Nervous System. What is Autonomic Nervous System? Today topic of discussion ANS, Autonomic Nervous System. What is ANS? Central nervous system, we have two component, brain and spinal cord. Can you see the brain and spinal cord? This is central nervous system. What is ANS? First we want to discuss ANS, then we will discuss the drugs. From brain, cervical nerves comes out. Okay, from brain cervical nerves come out. From that spinal cord, spinal nerves come out. So how many cranial nerves and how many that spinal nerves we have? We have 12 pair of cervical nerves and 31 pair of spinal nerves. Out of 31, these 8 pairs are cervical, 12 pair of thoracic nerves, then 5 pair of lumbar, 5 pair of sacral and single pair of coccygeal. So 8 cervical nerves, C1 to C8, 12 thoracic, so T1 to T12, 5 lumbar, L1 to L5, 5 sacral, S1 to S5, single pair, okay, C1 only. We have two type of nerves, sensory and motor nerves. Suppose this is organ and this is also organ, both are organs. What is sensory nerve? Sensory nerve is a nerve that takes the signal from the organ, takes signal from that organ towards central nervous system, that is taking the sensation towards the central nervous system. What is motor nerves? Motor nerves is a nerves that take the signal from the central nervous system towards motor. Okay, see that arrow. So this is the basic. This is sensory and this is motor. You can see that arrow sensory is taking the signal from organ to central nervous system. Motor nerves is the nerves that are taking signal from central nervous system towards the organ. Now sensory nerves are also known as sensory nerves is also known as efferent nerves. The motor nerves is also known as efferent nerves, because here we want to discuss this efferent nerve because our autonomic nerve system is created by efferent. So our ANS is created by this efferent. So here we not discussing in this sensory, we want to discuss only motor nerve system. So motor nerve system, we have two type of nerves. See this diagram, all are motor nerves. Okay, all are motor nerves. See the arrow. So motor nerves are carrying the signal from central nervous system towards that organ. So central nervous system towards that organ. See these arrows. So all are motor nerves. They all are motor, but what is the difference between them? Difference is the organ. Okay, different is the organ. See the organ, there are supplying. Can you see this organ? there are supplying here. So if there are supplying to voluntary muscles, so if there are supplying to these voluntary muscles, okay, if uh, we have contract our biceps, triceps, deltoid, okay, there are our voluntary muscles, all are our voluntary. With our wish we can contract and relax, so that one name is called as voluntary muscles. So this voluntary muscle is also known as somatic. Okay, somatic nerves or somatic system. Suppose there are supplying to involuntary organ. Okay, so in this involuntary muscles, which is also known as visceral muscles, which are also known as smooth muscles. Okay, this one name is called as smooth muscles. This one cannot our control. The smooth muscles which is presented in our heart, it is presented in our lungs, intestine, gland, whatever. So that is involuntary. It is called as smooth muscles. Okay, so it is not our control, but this one is our control. Somatic nerves our control. These smooth muscles, it is not our control. So skeletal muscles, the nerves which is supplying to that skeletal muscles, it is somatic system. That one name is called somatic system. And the nerves which is supplying to that smooth muscles, okay, smooth muscles are involuntary muscles. In our involuntary organ, it is autonomic nerve system. Okay, this name is called as autonomic nerve system. Let's start with this ANS, autonomic nerve system. This one is, okay, this one is the somatic. What is the biggest difference between them? Somatic, there is only one nose. Okay, only one nose from central nervous system to organ. It is starting from central nervous system and ending with the skeletal muscle. But ANS, there are two nerves. Okay, there are two nerves. The one is starting with the central nervous system and it is ending the middle. Okay, it is ending the middle. And second starting and ending that organ. Okay, again here starting and ending that organ, like this, here also, here also. So the junction of two are known as here also junction, here also junction. That name is called as ganglion. We have ganglion in autonomic nerve system. Okay, but not in somatic nerve system, because somatic we have only one, but autonomic we have two. So ganglion, there are two possibility. If that ganglion towards that organ, okay, ganglion towards that organ, near that organ, it is known as free ganglion. So ganglion, there are two possibilities. If that ganglion towards that organ, okay, it is known as free ganglion. So free ganglion, that free ganglion nerves is longer one. Okay, this one is the longer one. Post ganglion is the shorter one. If that ganglion towards the central nervous system, okay, towards that central nervous system, then free is short and post is long. So based on that, we have two type of autonomic nerve system. So free ganglion and post ganglion. Free ganglion is longer one, post ganglion is the shorter one. This one towards that organ. Okay, so this one is the parasympathetic nerve system. This post ganglion towards the central nerve system, so it is name is called as sympathetic nerve system. So this one towards that organ, so this one name is called as parasympathetic organ. This ganglion towards that nearby central nervous system, so it have that name sympathetic ganglion. So we have two types, parasympathetic and sympathetic. So ANS we have two types, parasympathetic and sympathetic. What are the different? If you can see, free ganglion fiber is longer and post ganglion fiber is shorter because the ganglion is towards that organ. Okay, towards that organ. But that sympathetic nerve system, that ganglion towards the central nerve system. So poster is longer. Okay, poster is longer, free is shorter. This is the different. So here ganglion close to organ, that's why free is long, post is short. In parasympathetic, in the sympathetic, ganglion is close to spinal cord, that's why free is short and post is long. So out of all nerves, there are 12 pair of cranial and 31 pair of spinal. Okay, this one parasympathetic, this craniosacral number 3, 7, 9, 10. So here pre-ganglion is longer, post-ganglion is shorter, presented here. This one pre-ganglion is shorter, post-ganglion is longer. So this is all about parasympathetic and sympathetic nerves. So parasympathetic, here ganglion close the organ, that's why free is long, post is short. Sympathetic ganglion is close to that spinal cord, central nervous system. That's why free is short and post is long. Before going to drugs, next we want to know neurotransmitter. Okay, so in brain, in the nerve system, autonomic nerve system, we have neurotransmitter. Okay, here we have neurotransmitter. So somatic system only, okay, this one only one nerve is there. In somatic system only one nerve only, so only one neuron is there. But in autonomic nerve system we have two, okay, two nerves. Here also two nerves. We record two transmitter, one at this ganglion and another one at that organ. So two neurotransmitter. Here only one nerve, so only one transmitter. Here one neurotransmitter for ganglion and one for that organ. So two neurotransmitter. So somatic system, it is only one. So here that neurotransmitter is acetylcholine. Okay, so acetylcholine secrete, this acetylcholine secrete organ, that is skeletal muscles, at that organ skeletal muscles, and it react with muscarinic nicotinic receptor, muscarinic nicotinic receptor. So this is done, but we want to look at this anatomic nerve system. Okay, now coming to anatomic nerve system, two or the two neurotransmitter is there. We record one for ganglion, one for organ. At ganglion, okay, at here also ganglion always acetylcholine, neurotransmitter only acetylcholine. Whether it may be parasympathetic or sympathetic, but here that ganglion neurotransmitter acetylcholine. At the organ in parasympathetic, again it acetylcholine, but that organ in sympathetic, it is not okay. Here it is presented noradrenaline. Okay, so the neurotransmitter which is present at that organ is the matter organ only different. Ganglion is same only, but that organ only different. That's why parasympathetic system known as parasympathetic system is known as cholinergic. In sympathetic system it is known as adrenergic because here it having acetylcholine, so it have that name cholinergic. Here it having adrenaline, so it have that name adrenergic. This is the summary. Neurotransmitter. In that somatic we record only one acetylcholine, but in autonomic nerve system we have two. One is sympathetic, another one is parasympathetic. We record two neurotransmitter. Okay, one free ganglion, another one is forced ganglion. One free ganglion, another one is forced ganglion. The rule is that free ganglion always acetylcholine. Free ganglion always acetylcholine. But that post ganglion is different. Here post ganglion in sympathetic, it is mostly noradrenaline. Okay, this sympathetic postganglion mostly noradrenaline, but sometimes it can adrenaline, dopamine, acetylcholine. But parasympathetic postganglion is acetylcholine. Both are acetylcholine. Sympathetic only different. Parasympathetic system is known as cholinergic. Why sympathetic system is known as adrenergic. Okay, so last before starting these chapters, their action generated. If we understand their action, it is very easy for understanding this chapter. Cholinergic, anticholinergic, adrenergic and anti-adrenergic. So we have 4 chapter we want to discuss one by one. So cholinergic system, anti-cholinergic, adrenergic system, anti-adrenergic. Totally 4 chapter we want to discuss.